No?
Okay.
Hi everyone, welcome to another episode of Veterinary Profession Podcast in collaborations with IVSA, ISCOCA and ISCOVI. Today with us we have Dr. Karen Kline. She is a neurologist and also a veterinarian working in United States, and she has joined the VCA Northwest Veterinary Specialist and previously in 2019 AD, and she has been working as a neurologist at a veterinary specialty center of Seattle from 2008 to 2019, and she stayed at AMC and completed her neurology residency, and also she have done her Masters of Science degree in veterinary pathology. So welcome, Dr. Karen.
Thank you so much. I really appreciate it.
So, like I just mentioned a few informations about your universities and working positions, but can you give a more informations about your name, surname, your where you studied your veterinary medicines, and your short working history, and the position that you are holding at the current scenario?
Yeah, so my name is Dr. Karen Kline, and I graduated from The Ohio State University back in 1989. And then I went on to do an internship and residency at the Animal Medical Center in New York City in neurology. And then from there, I did a clinical instructorship at University of Missouri, College of Veterinary Medicine. And then from there, went on to be an assistant and associate professor at Iowa State University, and then moved out to Seattle, where I was at Veterinary Specialty Center for about 12 years. And then for the past 5 years, or going on 5 years, I've been a clinical neurologist and past medical director at VCA Northwest Veterinary Specialists. And most recently, I'm also an associate professor half-time at Washington State University College of Veterinary Medicine. So I've been kind of all over the place as far as my experiences, but my heart and soul is in the academic environment and really teaching the students.
That's great to hear, since we are also veterinary students,
Yes.
and we hope that we will be able to learn more from you within this veterinary profession podcast and also in the future. So, first of all, like I'll just like to place some questions related to veterinary education so that our viewers can get some insight from your journey. Can you share with us your journey into veterinary neurology and how you become the president of NAVC, North American Veterinary Community?
Yeah, really, really good question. I had a great experience when I was in vet school, and I think we mentioned mentors, but I'll mention them later on. But I love the field of neurology because I can make paralyzed animals walk again. But my journey of becoming president of North American Veterinary Community, I was nominated by a friend of mine who is on the board of directors. And then when you're part of the board, you do what's called a presidential track. And I was invited to do that. So currently, I'm actually in Austin, Texas right now at the AVMA conference. It's a big national conference that the American Veterinary Medical Association sponsors each year. And so that's kind of my journey. It's been great. I've traveled everywhere and it's really been enriching for me.
Yes, traveling or around and meeting new people is always an enriching
Yes, it
experience. And
is.
also, I've seen some stories about AVMA and hope that you enjoyed that, and you also get a lot to learn about. So, moving on to the next question: what key experiences or milestones in your career have shaped your path in a veterinary medicine?
Yeah, so as a veterinary neurologist, we're part of the American College of Veterinary Internal Medicine. So we need to take two exams to become board certified. One is called a general exam, and the other one is a specialty exam. And I did that in 1994. So that really paved the way for me to go on and do the things that I've done. And certainly my experience with NAVC being the president has been fantastic, and just meeting tons of people in the field has been wonderful. So that's been great.
Thank you for your answer. So, talking about the current scenario of veterinary curriculum, especially from where I belong, like we don't have a veterinary courses that focused on a specialized field like neurology. Do you feel like this field is sufficiently covered in a general veterinary curriculum worldwide?
I think there's always things we can learn because this veterinary medicine is ever evolving. And I think the biggest thing that I tell my students is getting the core, the neurologic exam, and then neurolocalization. And it's our job as specialists to share, I think, that information and make it easy to understand. So any way I can help with that in the process is, and I think that's so important to pass it on and pay it forward, if you will. That's a term we use in America all the time. But and we want to make it less scary for people because neurology sometimes is kind of a taboo, but it's not as hard as what people really think it is, I think.
Yeah, nerves and brain are always the complex thing to deal with. So,
Yes.
I think that people might be scared to like learn a lot about this. And also we have some people is stepping forwards and working to understand the neurology better and contribute to the veterinary field. I'm sorry, like mm, I'm having a bad nose right now, so sorry for
I
my voice.
understand. So am I.
Uh, so the neurology field, or even when we're talking the veterinary field, like it is a evolving field, right? So there are constant changes and there is ongoing educations and professional development that you need to catch with. So what do you think, how important is ongoing educations and professional development for veterinarians, especially if we are talking in the field of neurology?
Yeah, and I think that's a great question. And I think that just keeping current in terms of veterinary journals and going to meetings, keeping up to date on the most recent innovations, I think is very, very important. And the other thing is it keeps you sharp and it keeps you informed and so you can do the best medicine for your clients and your patients. And I think it's ever changing. So it's important to stay up and relevant on those things, especially with all the specialty fields that we have.
Thank you for your sweet answer. Do you have any mentor to guide you on your path?
Yes, and when I was in veterinary school, the neurologist, Dr. Bill Fenner, who is a great man and very wise and wonderful and worldly, he really made the specialty make sense to me. And I've had other friends and mentors in my career journey that have helped me immensely and opened up paths that I never thought would be available to me. So you never know. And I think the biggest thing is identifying people that are going to be supportive of you through thick and thin and through the good times and the bad times and everywhere in between, because sometimes there are upsides and downsides to our career, but you just need to be marching forward and always stay as positive as you can, because realistically we're in a field that we're very lucky and fortunate to be a part of. And not everybody is able to do this. So I think, the things that you guys are doing and really getting students involved, and because you guys are the future of veterinary medicine. So anything we can do as mentors to help you guys is always helpful, I think.
Thank you for saying that. And also, like, you guys learn, and you guys have much more experience than we do. And gaining your experiences and gaining your knowledge would obviously gonna help us, and also to shape the future of veterinary medicines in a perfect way, and for the future generations also. So, moving on
Yep.
to the next question. Uh, while before starting the veterinary profession podcast, like I have come up with some of my friends studying in a different part of world. Like they are really interested and they want to learn about the neurology a lot. So how can such a student gain the most experience in this field? And what would you say to those who are looking to build up career in this sector?
Yeah, and I think that's a great question. And now these days, since we have, electronic communication like Zoom and other avenues like that. I think, just having one-on-one conversations or having a forum where like this, where we can ask questions, if you're fortunate to be able to work with a specialist as a neurologist, where I am at Washington State, but also at VCA, we do have preceptors and people come in from all over the place. And I know sometimes that's monetarily and financially not possible, but even being a part of rounds and other things like that, or just having a forum and asking questions, I think is always a possibility. And I think the giving back part of it is important. And just so you guys can pick our brains, if you will, pardon the pun. But I think that's really important because, veterinary medicine is not always the puppies and kittens, but when you're specializing, sometimes you have good days and bad days, but for the most part, it's a very enriching experience. But, certainly I think getting to know a mentor, I think is very, very important, or multiple mentors.
Thank you for your sweet answers. Yeah, you mentioned having a mentor is important. So, can you discuss the role of mentorship in a veterinary education and career development, and how it can impacted your journey as well as how it can impact the journey of a student?
Yeah, and I think just identifying one or two people that have done what I have done and what other people have done, but not only that, not only just neurology, but different fields, because sometimes as a veterinary student, you're like keyed in on doing one specialty when in actuality you may end up doing something else. So my biggest advice to you guys is to keep your minds open to anything. And when you see an opportunity arise, just, say, hey, if you're at a conference or a meeting, you can ask for someone's business card or their contact information, and then you can develop that lifelong communication. And it's not just about our field, but it's also about how you develop as a human being and how you respond to stressful situations and other things like that. So besides the hard science, I think it's important to develop that relationship so your mentor can be your coach. I think that's really important. I just heard recently, if you're doing sports, you're going to have a coach, and why not have a coach when you're doing veterinary medicine too? And that's what mentorship is all about, to talk through things, and whether or not it's, again, the hard science or cases, or when you're negotiating a contract or doing anything like that, I think it's important to have people that are available to bounce questions off of.
So, you passed your DVM in 1989, right? And
Yes.
it has been around a journey of around roughly around 30 to 40 years you have been in a veterinary field. So, what changes or the initiative do you foresee in a veterinary educations and professional development? And how was the scenario when you just started your DVM?
Yeah, so it's been a while. And I've seen especially in neurology, the evolvement of MRI and imaging and other things like that, 3D printing, new innovations in drug therapy. So, when I first started, I didn't even have access to an MRI, but now as a veterinary neurologist, and we're very, very fortunate in this country to have that capacity, because it's revolutionized what we can do as part of the treatment of our patients and our clients. And the other thing is just all the other specialty fields. There are things going on that change all the time, and that's why it's important to go to these meetings if you can, or Zoom in, or do it virtually, however you can, just to hear about the most recent developments. And the other thing is too, in the United States, we've just opened 14 new veterinary hospitals, veterinary schools. And, how do we get faculty to teach it, because I can only do so much. I can't be in 10 places at one time. So really concentrating on the student experience and what that means, because I think, again, as I mentioned, you guys are the future. So anything we can do to give back, I think is really important. And, the question is whether or not virtual meetings or hands-on experiences, we're going to have to look at that for the future and really pay attention, I think, to that.
Well, it's a great news to see that the veterinary field or the veterinarian student summers is going to increase in the US, and I hope that this is going to bring a positive change in all across the world. And so you mentioned about the MRIs and the 3D printing. So these are the current trend and the advancement. Can you discuss any more of any more that we are currently using in a veterinary neurology
Yep.
that an aspiring veterinarian should know as they prepare for their careers?
Yeah, and I think, certainly just like human medicine, we're behind as far as a lot of things. But on the other hand, we have access to radiation therapy, targeted radiation, other therapies like monoclonal antibodies. I just went to a lecture yesterday about using a drug that is targeted for pain management in osteoarthritis. So I think, we can blend the hard science and the research along with our spectrum of care. So how do we pinpoint how we're going to teach our students to look at each patient and client and see what they need as far as their needs and such? And it's ever evolving. And I think we just need to keep our minds open to what is available out there, and just, having that personal touch with our clients and our patients. I think we can't ever forget about that. So I think that's really important.
Yes, I can relate with that. Having a like a personal thoughts and connections with uh, pet owners or the even with the clinicians or just with the fellow workers is really like a good things to do, and it also help to develop a communication skills and all. So now I like just to shift some questions from career perspective, and where we'll be discussing about the soft skills and attributes. So moving on to the first questions, could you share your insight or experience regarding the importance of communication skills in a veterinary medicines, particularly when you are interacting with clients and colleagues?
That's a really, really great question. I think as veterinarians and as you guys come up in the ranks, we tend to be, as veterinarians, kind of introverted and shy people. But I think the most important thing as far as communication is to be honest. So when I talk to a client, I give them all of the options, and they choose what they can do financially and emotionally. And as far as colleagues, I always say, we have in America what we call the golden rule. So be kind to others, and hopefully they'll return the favor to you, and just be respectful. Especially when, as specialists, we get referrals from other veterinarians, and maybe they don't have the most up-to-date technology, but, I think we need to walk a mile, as we say, in their shoes, and just be empathetic. The world is kind of a crazy place right now. We just need to be kind to people and give them the benefit of the doubt. So no matter who it is, and the other thing is not judging people and our clients in terms of finances, because everybody deserves to have a pet, but not everybody can get the care they need. But I think that's important worldwide. I was just at a meeting last night about the human animal bond, and everybody's entitled to have a pet because it's enriching to their lives, but we need to make sure that we can provide the care that they need for sure as well. So I think that's really important.
Well, that's really nice answer to hear from you. And so talking about the leadership skills and role, like you have been in a role of NAVC, and also you have been in a role of as a assistant professors, and you have been leading a team of either students or also you are working in a team, right? So could you elaborate the leadership qualities that are crucial for the success in a high level veterinary leadership role like yours?
I think the most important thing is listening, because, rather than talking, and I always, whether or not it's my clients or my colleagues, let's talk about it. Let's look at divergent opinions. Let's try to come up with a consensus, because at the end of the day, I think listening is the biggest quality, that listening and understanding. And again, having that empathy and walking a mile in people's shoes and understanding where they're coming from, even if you don't necessarily agree with what they're saying, but just ask me why you're thinking that. Not in a offensive way, but help me understand, what you're thinking so I can help, to develop a solution to a problem, because that's what veterinary medicine is all about: consensus building. And sometimes we don't always agree on things, but from that change comes innovation. And I think that's really important. And just being respectful of everybody, and being a role model, and that is from the way you dress to your mannerisms to your body language, language and all that stuff. And just being a leader. Being a leader is hard, because some days you just want to sit back and not do that. But, certainly, and everybody has their own style. So I think that's the other thing. And the other thing I like to think about is being authentic, your authentic self. I know that sounds cliche, but you can't put on a different mask. You just have to be who you are, and really read the room and make people feel heard. And I think that's important as we go on, for sure.
Yeah, I completely agree with you. And also, like being in a leadership role is sometimes difficult. Like sometimes you might need to act tough, and sometimes you might need to act soft, depending upon situation. And like
Yes.
sometimes people might not get you. That might be also a problem. But being a leader, like you are supposed to take everyone with you. So that's really a nice qualities to have. And also talking about the next soft skills or attribute, adaptability and flexibility. I like to discuss more about this because when I'm seeing in my context, like I feel like being an adaptable and flexible as a veterinarian is more essential. So in your experience, can you see this navigating the evolving landscape of veterinary medicines and public health?
Yeah, I think it's important. And I think as veterinarians, sometimes we're very afraid of change because we are in routine. And myself, I'm a very routine oriented person. And I think, we need feedback, because if, for example, someone says, gosh, you're afraid of change. Okay, what can I do to become more adaptable and flexible? Because I've been doing this for a long time, but just because I've been doing it for a long time doesn't necessarily mean that my ideas are, going to be the same. So, and that comes from just communicating with people and seeing what works and doesn't work. And I think the biggest thing to understand too, from a public health standpoint, we need, in our field, there are zoonotic diseases and other things that we need to be aware of. In my country, there are certain parts of our country that people don't think infectious disease exists. And because of all the things that are happening in the world, with it getting warmer, those things are changing. So we need to be able to be flexible and understand that, okay, these are topics that we need to talk about because it's the future. So I think that's important.
Thank you for your answer. So
Yeah.
um moving on to the sorry moving on to the next question. Like even in a neurological field or just working as a leadership skill in an NAVC, sometime you might have come with the problems that you might have feel okay, this is something undoable, but after that you figure out with that or something like that. So can you just provide us some example where the problem solving skills have worked for you in the challenges or the complex situation?
Yeah, and I think that's really important, and especially when you're in a mentorship role, because things can look pretty dire sometimes, but I tend to always look on the positive side of things. What if this, what if that, what if it's not a tumor? I think, again, the biggest thing is just listening to people and then deciding hey, let's come up with solutions instead of saying there's not a solution to this issue. Why don't we identify 2 or 3 talking points and walk through it and then decide what's best? And maybe, you know, some of those points are not always what we agree with, but it's as a group, what's the best solution. So I think, you know, we can all learn from each other, and sometimes we just need to, you know, put our egos in the back room a little bit and say, hey, maybe I'm not thinking about that as I should, because that's the value of having older and younger people in the middle. Because now, you know, we can work on the issues and then move together on things.
Mm, Thank you for your answer. So now we are toward the end of our session. So before the last, like I have just two more questions to go on. Uh, like, what was your motivation to pursue veterinary medicine as a career?
What was my motivation to pursue it
Yeah,
as a career?
yeah.
Yeah, I ever since I was a kid, a child, I wanted either two things. One, to teach, because I just love teaching, but also I love, and I know this sounds corny, I love animals, but I'm living the best world of doing the things that I absolutely love to do. And I know you had one question about professional development. We do have an international scholars program through NAVC, so you can apply for that. And what we do is fly you over to our big VMX meeting in Orlando, Florida. It's one of the biggest conferences in the country and the world. And we give you VIP status and just opportunities to be a part of the meeting and everything like that. And if anybody's interested in that, I can certainly provide a link for that. But we've seen people from all over the world, and it's a fantastic experience.
Yeah, that this might work for the most of the student who want to get in touch or just hear about this. And I know that there are a lot of students within IVSA who are interested for such opportunities. So they will just grab these opportunities, and you can provide me link and I can insert this in a YouTube
Yep,
description. Guys, you can find
that
this in
is
the
perfect.
description.
I sure
So
will.
moving on to the last question. If you could go back in a time and give yourself advice while you were a vet student, what that would be?
Oh boy, that's a tough question. I think a lot of veterinarians, no matter your origin, your ethnicity, whoever you are, I tend to think that we are too hard on ourselves and we're perfectionists because we have high expectations of ourselves. I would say that we never want to you know, be less than what we are, but we also need to give ourselves, what I always say is, a little bit of grace, and say it's okay to fail, because we've all had situations where things don't go as we want to, but we can learn from that and just be a better person, and just be kind to people. You know, I know that sounds corny, but it doesn't come intuitive to a lot of people. So just give people the benefit of yourself, but you also need to just remind yourself that you're human and not superhuman, for sure.
Yeah,
Although I'd
that
like to be, but I'm not superhuman, that's for sure.
yeah. Everyone loves to be a superhuman and everyone likes
Yes,
superhuman, but yeah, we have some problems, and it's okay to have problems, and it's okay to not be perfect, but you can work to be a perfect. So that's a
yes.
really nice thing. And I also feel like since we started a veterinary career in a early 20s or 21, we don't know a lot about the life. So that might also be the reason people feel scared of, or they just want to be perfect, and they just think that if I'm doing this, then this must be a right or wrong. So yeah, that's my
Yes.
perspective on this. So thank you for being here, and we are toward the end of our veterinary profession podcast. It was really nice having these conversations with you, although I'm having bad voice at the moment. But
You need to drink some tea. You
yeah,
need to
like
drink some tea and get some
I
rest.
I tried that. It's because I just went to the swimming today, and because of that, my voice is really shaking at the moment. But it was really nice talking with you, and we have been planning this from a quite long. And yeah, you supported us in a way, and we also want this support to continue in the future, and we want to be more connected with the NAVC or American Veterinarian associations, so that we can educate more people around the world and mm, inform them about the changes or the perspective that's going on around the world, or especially in the US, because uh, we consider, like I consider US as a milestone in this field. So learning from
Yep.
your experience or learning from other vet across the world is really a nice opportunities for us. Thank
Yes,
you
and
for being here.
anything we can do to help, and I'll send you the link for the International Scholars Program. And I look forward to working with you guys, and anytime you need any lectures or anything like that, just let me know.
Is this scholars available for the students or a bed? Because we also do have alumni network, which consists of a DBM veterinarian students, and we have IVSA members who are basically the undergraduate students.
Great, great.
So saying that, I'll just like to end this session